My name is Louise Cruz, and I am the Nutrition Program Coordinator for WellWorks. And today's nutrition break topic is keeping your immune system strong. This is an overview of what we're going to be talking about today. So the nutrition part, we're going to be talking about gut health, vitamins and minerals, balanced diet, herbal supplements, and food safety. And then we're also going to touch on lifestyle, which includes smoking, alcohol, stress, and exercise. So the immune system works by releasing histamines, which cause inflammation. Inflammation is a very normal part of the immune system response. It can generate pain, swelling, release of fluid, and low-grade fever to combat illness. But chronic inflammation can actually depress the immune system, or on the flip side, it can cause it to be hyperactive and attack healthy cells. So a little bit more about the immune system. Malnutrition and nutrition deficiencies are the most common cause of a compromised immune system. Obesity and overnutrition can also reduce immunity, in part by adding to that problem of chronic inflammation. Obesity is actually a risk factor for hospitalization and death from COVID-19 because it weakens the cellular immune system function. And actually, the CDC is saying that 94% of COVID deaths are linked to chronic disease, including obesity. Other things include diabetes and cardiovascular disease. A diet that's high in sugar and fat and simple carbohydrates can also cause chronic inflammation. So because nutrition is such a huge part of this, let's start there. So first, the gut is the biggest part of your immune system. So it's really important to keep it healthy. The gut flora, which is the good bacteria in your gut, which is also known as probiotics, are an essential part of your immune system. Think about this. It's made up of 100 trillion live microorganisms. That, to me, is just amazing of what your body does. And 75% of that is our actual immune system. And those probiotics prevent infection and regulate the mucosal immune system. The probiotics fight harmful substances that we ingest, and they prevent the growth of harmful bacteria. And when you're on an antibiotic, those probiotics get killed. So it needs to be reintroduced, and that's why you're told to eat yogurt when you're on an antibiotic. Now, prebiotics are what the probiotics feed on. So they're non-living, and they're basically insoluble fiber. And good sources of the insoluble fiber is fruits, vegetables, and whole grains. Harmful bacteria use the dietary proteins and fats to produce toxins, and that can damage your immune system. So let's look at some of the vitamins and minerals that are really important for your immune system. So the first one we're going to look at is vitamin C. It is a very powerful antioxidant, and it's actually one of 3 vitamin antioxidants. The other 2 are vitamin A and vitamin E. A deficiency in C can impair immunity, putting you at a higher risk for infection. And during illness, those vitamin C levels actually decrease. Supplementation with vitamin C has shown to both prevent and treat infections, including respiratory infections. Some good food sources include citrus, berries, peppers, broccoli, Brussels sprouts, and leafy greens. For women, the RDA is 75 milligrams, and it's 95 milligrams for men, with an upper limit at about 2,000 milligrams. It's water soluble, so it is a safe supplement. Water soluble means that it's just going to pass right through your body, whatever you don't absorb. And that's when you see that kind of fluorescent yellow urine when you're taking vitamins. Those are the ones that your body didn't need. If you take over 1,000 milligrams at once, it can cause GI upset. So just keep that in mind. All right, another one we're going to look at is vitamin D. The vitamin D receptor is in most of our immune cells, so it plays a real important part in their activity. If you avoid the sun, don't drink milk, or you're overweight, then you're at risk for a deficiency. And a deficiency in vitamin D has been linked with increased death from cardiovascular disease, also increased with cognitive impairment, asthma, and cancer. And now there's evidence that with adequate vitamin D levels, there is reduced respiratory infections and severity of illness with COVID-19. This has been studied a lot since we've been in the pandemic, and it is very common now that people supplement with this vitamin. Okay, food sources include mushrooms, sardines, mackerel, herring, dairy foods, and fortified foods. 5 minutes of sun a day, which is about 30 minutes a week, is probably enough to get all the vitamin D you need. So if you're not eating those foods, it's okay. The RDA for this vitamin is 15 micrograms a day. And if you're over 70, it's 20 micrograms a day. You can take up to 4,000 international units a day, and it's considered safe. B12 is necessary in the production of red blood cells, which oxygenate the body. So they just move that oxygen through your whole body. And that makes them a crucial part of the immune system. A deficiency will impair the immune system, obviously, right? People over the age of 50 and people who are vegetarians and vegans are usually deficient. So good food sources of B12 include fortified nutritional yeast, some fortified cereals, and animal proteins. The RDA is 2.4 micrograms a day. And just for a note, 1 tablespoon of fortified nutritional yeast can contain up to 5 micrograms. So you'll get double of what you need with just that 1 tablespoon. Supplementation of 50 micrograms a day, or you can do 2,000 micrograms a week, not take it every day, is fine. It's water soluble. So again, you're just going to absorb what you need and you're going to pass the rest right through. Supplementation is strongly encouraged for vegetarians, vegans, and people over 50. You can get B12 in a multivitamin, so you can use that and that's fine. Zinc, also a very important part of the immune system, and another nutrient that there's been a lot of studies on since the pandemic. So it's very important for the immune system. A mild deficiency can cause defects in the immune response and actually increase your risk for sepsis. Deficiency impairs wound healing and increases the risk of pneumonia and the loss of taste and smell. Food sources include beans, peas, lentils, nuts, seeds, soy products, animal protein, and oysters. The RDA for this nutrient is 8 to 11 milligrams. The upper limit is 40 milligrams. With all the studies that have gone on this past year and a half, there's really no good evidence that shows supplementation is helpful. In some cases, if blood work shows that the patient was severely deficient in this, they would supplement, but overall, there's just nothing to really back it. So you just want to make sure that you are including these foods as part of your diet so that you do keep your levels up. Selenium, also very important to the immune system, and a deficiency in this can lead to not only a risk of infection, but may also lead to some cancers. There is some evidence that deficiency in this can increase chronic inflammation disease in the gut and in the liver. We already talked about that. We want to avoid that chronic inflammation. Food sources for this include whole grains, Brazil nuts, and animal proteins. The RDA is 55 micrograms and more is recommended for immunity. The upper limit is 400. Okay, so looking at all these nutrients, we do see that the basis for most of them are in plant foods. So there's a few different ways that you can look at this when you're trying to balance your diet. So the first one is the My Plate, which is put out from the USDA. And it's really a pretty good tool. If you look at it, 75% or 3/4 of the plate is plant-based plant-based. So you've got vegetables, fruits, and grains. And those grains really need to be whole grains, things that contain a lot of fiber, maybe contain some seeds. Protein can come from animal products. They can also come from legumes. So you could actually make this 100% plant-based, which you see in the next picture. That is 100% plant-based. There's no animal protein in there at all. You do see the legumes where you're getting some protein from. The other thing I want you to remember is what we call G-bombs. You want to make sure that you are getting these in your diet. Basically, they are your greens, beans, onions, mushrooms, berries, and seeds. So all those foods right there, if you are taking in those, a good amount of them every week, then your immunity is going to be in good shape. And it looks delicious, doesn't it? So let's look at herbal supplements. This is a big thing. You're always hearing on the news about different supplements, and we like to take them. So let's look at some of them that might be helpful. So first, Echinacea. Echinacea has been around for a long time. It can decrease the odds of getting the common cold, and it has been shown to decrease the duration of a cold. It can reduce the effects of upper respiratory infections, and it may be more effective with intermittent use, which means take it during the winter months and lay off of it during the summer. Ginger is also a great supplement. It has potent anti-inflammatory properties, powerful antioxidant, and it may halt the growth of bacteria and ease respiratory infections. Along with that, I put in honey because it contains antiseptic properties and is a potent prebiotic. So honey ginger tea is a great thing for your immune system. Turmeric and curcumin. So this supplement is shown to reduce inflammation, also a very potent antioxidant. In food, you would only need about 2 to 4 tablespoons a day, but there are a lot of good supplements out there. And if you're supplementing, you can take anywhere from 500 to 2,000 milligrams a day. The bioavailability of this supplement is better when it's combined with black pepper. So either when you're cooking, use it with pepper, or when you're purchasing a supplement, make sure it has that in it. Food safety, also very important. If you are getting illness from your food not being safe, your immune system is going to be weaker. So you really want to be mindful of this. So watch expiration dates, store cold food cold at less than 40 degrees, and frozen items should be at 0. Keep raw foods separate from ready-to-eat foods, and that includes when you're at the grocery store. So you don't want to be packing your hamburger meat with your apples. Keep those items separate. When you do have food out on the counter, there's a thing called the danger zone. So 40 degrees to 140 degrees is when bacteria can rapidly multiply. So you want to limit that time that food stays in that danger zone. The recommendation is less than 4 hours. I say that's high. I would say keep it less than 2 hours. And then when you're cooking foods, you want to make sure that you're cooking them to the correct temperature to kill bacteria. So for poultry, you want to cook it to 165. Ground meats, you want to cook to 160. Whole cuts of meat to 145. And when you're reheating anything, you really want to take it to 165 so that it kills any bacteria that may have formed when that food was sitting out originally. Lifestyle. Also very important to keep your immune system healthy. So first, alcohol. We really need to try to avoid it, or at least drink in moderation. And moderation means 1 drink a day for women and 2 drinks for men. And remember that binge drinking can actually increase the risk for cardiovascular events. Sleep is very important. Alcohol does disrupt the sleep cycle. So a lot of people will say, well, I have a drink or 2 before bed because I sleep better. But notice you may go to sleep better, but you're probably waking up at maybe 2 or 3 in the morning. And that's the alcohol disrupting that cycle. When you sleep, the body actually fights infections. So that's why people always say, if you're not feeling good, get some rest. The sleep really does make a difference. And you're supposed to get 7 to 9 hours per night. How many of us actually do that? Not just on the weekends, every day. Okay, the other thing is de-stress. Stress wreaks havoc on the immune system and pretty much any function that we have. Meditation is a great way to de-stress and strengthen the immune system. And even 5 minutes a day is beneficial. If you don't know how to do it, there's all kinds of great apps that you can get on your phone. Just look online. You can find lots of ways to learn how to meditate. Reiki is a practice of healing through energy. And there's a lot of research that's coming out and backing this practice. Mayo Clinic and Cleveland Clinic both offer it. And actually, there's over 1,000 hospitals and clinics in the United States that do offer it. A lot of the benefits, people say they feel like they've had a massage when they're done. It feels like meditation. So it really is a great way to strengthen the immune system. Yoga, it is exercise, but it's also stress relief, and it connects the mind and the body. So it's very important. So let's talk about exercise. CDC, HHS, and American Heart Association recommend about 2.5 hours of moderate physical activity a day. That is 30 minutes, 5 days a week. I know we're all busy and we all use that excuse that I'm too busy to exercise. But if we really think about that, a brisk walk for 30 minutes, 5 days a week can really make a big difference. If you're going to do vigorous aerobic activity, you only need an hour a week and then about 2 days of strength training. The goal should be 5,000 steps a day. We really should reach for 10,000, but 5,000 is a good place to start. And honestly, during the pandemic, I think most people's footprint shrank because now we're working from home, a lot of us, and we're not getting out as much. So that 5,000 steps a day can actually be pretty tricky. So in summary for all of this, you really want to maintain a healthy weight. You want to enjoy a plant-based diet, avoid sugars and processed foods, supplement if needed, but always check with your physician first just to make sure you're not overdosing or that there's not any negative reactions with medications you might be taking. Relax, just breathe and relax and be physically active. Doing all of that is really going to make a huge difference on how you feel. These are references that I used for today's presentation. I hope you enjoyed it. I hope you get something out of it. I am available for one-on-one sessions. Just go to the WellWorks portal and you can schedule a session with me. We have a lot of other really great stuff on that portal too, so check it out. Thank you very much. Have a great day.